A coalition of NGOs, including Section 27, the TAC and trade union DENOSA, have called on the Health Ministry to urgently intervene in the health system in the Eastern Cape. They've given the Health Department 2 months to draft a plan of action to deal with the problems, or else they'll take action. For more on this story, we're joined now by Section 27 attorney Sasha Stevenson. Thank you so much for joining us. What did you find in the Eastern Cape?
We found a crisis. We've spoken to healthcare workers, patients all across the province, and we found that there are serious problems in the healthcare system, including problems with facilities, with healthcare workers not being paid or being absent, with patients not receiving the treatment that they deserve.
Are these problems unique to this province?
I don't think they're unique to the province, but they're certainly acute in the province. The extent of the crisis that we've seen suggests that urgent action needs to be taken, and that's why we've been...
Describe some of the things that you've encountered.
We've gone to clinics where there is no electricity and no water. We've spoken to a woman whose baby died and was essentially aborted by having to walk around a hospital ward bleeding, being watched by others. We've spoken to people who have been treated appallingly in hospitals, to nurses and to doctors who haven't been paid and who have had to work in appalling conditions. It really is a terrible situation in the Eastern Cape. It's certainly not the only place where the health system is at such risk, but it's a province in crisis.
Aren't a lot of these problems inherited by this government, given that it had to encompass 2 former homelands, which are direly under-resourced anyway?
Certainly that is a large part of the problem. The Eastern Cape has serious historical problems, but it's certainly not only a historical problem. Budgeting remains a problem and remains unequal, but this is an issue that's been going on for a long time, and we've seen in the democratic era mismanagement of people and of funds, and it's time to say this has to stop.
What do you want the officials to do?
What we're calling on is for the MEC to formulate a plan that deals with some of the issues that we've raised, and in some cases deals urgently with some of the urgent problems that we're seeing in the Eastern Cape, and to show commitment towards solving these problems.
Do you think he's not committed?
I don't know. What I've seen is a terrible situation in the Eastern Cape. All I know is what we can see on the ground, and that doesn't suggest commitment, but we look forward to seeing more commitment from the Eastern Cape Department of Health.
Do you think the Eastern Cape Health Department at the moment has the capacity and the resources to formulate such a plan and implement it?
I don't see why not. It's their constitutional obligation to do so.
Does it have the resources? Does it have the money? Does it have the people?
Well, from what we've seen, there are resource problems, but there's also huge wastage and huge misallocation of funds. And so I think the people of the Eastern Cape can expect more and do expect more.
What's been the response from the minister at a national level?
The minister has seen our report and was horrified by its contents, mainly because the stories in the report are gut-wrenching. They are of individuals in the Eastern Cape who have suffered dearly at the hands of this healthcare system that is failing. And what he said is that he intends to take action. He's committed to intervening in certain respects. We don't know yet exactly the extent of his intervention, but we do have faith that he will take the action that's needed. But of course, the primary obligation is on the Eastern Cape Department of Health, and so we need both of these departments, national and provincial, to work together to solve this.
And if nothing is done, then within the 2-month time frame that you've given, what action will you take?
Well, we've been speaking to a lot of people across the Eastern Cape, and we have a lot of statements from a lot of people. We are hoping that we won't need to resort to legal action, but it's something that we're always prepared to do. It's something that we certainly won't rush into, but it is a last resort, and if we do need to, we will do so.
Thank you so much for your time. That was Sasha Stevenson, an attorney from Section 27.
News that moves. eNCA.com.